Ocular motility. In an eye exam, a technician will routinely check ocular motility and muscle alignment. In the session, you will gain basic knowledge of what strabismus is, how to distinguish aphoria from atropia, and successfully perform a standard H pattern ocular motility exam. Strabismus is the group of conditions where the eyes point in different directions. The general population uses terms like wall-eyed or cross-eyed to describe strabismus. One eye may look straight ahead while the other eye turns in, out, up, down, or diagonally. The misalignment can exist in one eye only or shift from one eye to the other. Strabismus affects vision, since both eyes must aim at the same spot together to see properly. When a person has strabismus, they may experience double vision, poor depth perception, or visual confusion. There are 6 eye muscles which surround the eye. The medial rectus muscle moves the eye toward the nose. This is called adduction. The lateral rectus muscle moves the eye away from the nose toward the temple on the same side. This is abduction. My method for remembering the difference between adduction and abduction is that in adduction, they want to be added together or come closer together. In abduction, the eyes move farther apart, like one eye is being abducted from the other. The other 4 muscles move the eye vertically, up and down, diagonally, and slightly rotate the eye. These muscles are the superior oblique, inferior oblique, superior rectus, and inferior rectus. In order to focus on a single image, all eye muscles of the 2 eyes must work together. To direct and focus both eyes on a single target, the eye muscles must coordinate with the brain. Children with strabismus often learn to suppress the image in the turned eye so that they don't see double. The brain ignores information coming from the turned eye. Most adults with strabismus have had it since they were children, but sometimes it starts later in life. When strabismus starts later in life, adults may notice other symptoms, like weakness in or around the eyes, or feeling like something is pulling around the eye, and vision changes, such as double vision, blurred vision, trouble reading, or a loss of depth perception. People with strabismus may tilt or turn their head to see an object as single and clear. People who have strabismus can have a systemic problem which affects one or more eye muscles, injury, damage to eye muscles during eye surgery, and health problems such as diabetes, thyroid eye disease known as Graves' disease, myasthenia gravis, brain tumors, or stroke. The most obvious symptom is having eyes that appear out of alignment. Strabismus symptoms can be constant or they can be intermittent, meaning the symptoms come and go. Common treatments for strabismus are surgery to loosen or tighten the eye muscles, vision exercises to strengthen muscles and the brain-eye connection, prism lenses to redirect images closer to where the eyes are pointed, and Botox to paralyze the overactive muscle. The 2 primary types of ocular deviations are the tropia and the phoria. Atropia is a true strabismus where there is a misalignment of the 2 eyes when a patient is looking with both eyes uncovered. Aphoria, or latent hidden deviation, is observable when binocular viewing is broken by covering an eye. The covered eye will move to its natural resting position while the uncovered eye still fixates on the object. Orthophoria is a term used when the eyes are perfectly aligned. If an eye is covered, the covered eye does not move and is still in alignment with the other eye, which is viewing the object. There are 4 types of tropia. Esotropia, the eye turns inward towards the nose and is written as capital E, capital T. Exotropia is an outward turn away from the nose. This is written as capital XT. Hypertropia, the eye turns upward. This is written as capital HT. And hypotropia, where the eye turns downwards. This is written as hypo-T. The cover test is a basic way to check alignment of the eyes. The unilateral cover and uncover test detects tropia. Here, you will sit close enough to the patient to be able to observe movement of the eyes. The patient fixates on a target at the appropriate distance with both eyes. Cover one eye and watch the other eye for a tropia corrective movement onto the target. Note if the eye moves right, left, up or down, or diagonally. If the uncovered eye moves, the patient has a strabismus. Then uncover the eye to allow for binocular viewing. Repeat the process covering the other eye and observe the fellow eye for movement. If you notice one or both eyes move when the other eye is covered, and the patient is new or a strabismus has not been noted before, please inform your doctor. They will be able to make a more precise diagnosis. Phorias are hidden when looking at the two eyes simultaneously. When viewing binocularly, the eyes are aligned on the object of interest, and the two eyes are being used together to see a single three-dimensional image. However, phorias can cause eye strain and other symptoms. Phorias can be detected using the alternating cover test. This is usually performed immediately after the cover-uncover test. To check for a phoria, keep yourself within arm's distance of the patient. The patient continues to look at the target. Cover one eye and keep looking at the side of the covered eye. Move the occluder quickly to the other eye without allowing for binocular viewing. Continue to pay attention to the now uncovered eye, and you should observe for any movement when the occluder was removed. If you see movement when the eye is uncovered and the patient tries to pick up fixation on the target with that eye, you know the eye was turned while it was covered. Then, quickly cover the other eye without allowing for binocular viewing. If the patient has a phoria, you will see both eyes move when they are uncovered. The right eye will move in the opposite direction of the left eye. If the right eye moves right and the left eye moves left, this is esophoria, notated as a capital EP. If the right eye moves left and the left eye moves right, this is exophoria, or XP. If the right eye moves up and the left eye moves down, this is a left hyperphoria, notated as an LH. If the right eye moves down and the left eye moves up, this is a right hyperphoria, or RH. The position of the eyes and results of testing can be very different when a patient fixates on an object up close versus at a distant object. This is how you record findings. If a deviation is noted, record it in the medical record. You will likely need to have your doctor determine the exact terminology for the deviation. Some examples are RET, which means right esotropia, LXP, which is left exophoria, XT means alternating esotropia, RH means right hyperphoria, L-hypo-T means left hypotropia. The recording may also state if a strabismus is constant or intermittent and what pattern it follows. Your doctor will have a better understanding of these notations. Now, we will discuss the standard H pattern test. Sometimes the strabismus will appear only in certain directions of gaze. A patient may not have the full range of movement in one or both eyes. We use the H pattern test to pick up eye movement restrictions or misalignments. This is important to determine if further testing like brain or orbit imaging is needed. In some cases, irregular eye movements can be the first sign of health problems like diabetes, multiple sclerosis, a brain tumor, or stroke. To test extraocular motility, sit about 2 to 3 feet in front of the patient. Hold up a finger, pen tip, or something small the patient can see and track with their eyes. Hold the fixation target at the patient's eye level in the primary position, or straight ahead. Instruct the patient to follow the object with their eyes and try not to move their head. Move your target in a capital H pattern and observe for equal eye movement in the 6 cardinal gaze directions. You may sometimes need to lift the patient's eyelids to see their eyes. Looking at where the light reflects on both eyes can be helpful, especially when the openings between the eyelids are not the same. Observing a lot of normal eyes will help you detect abnormal eye movements. If a deviation is noted, record findings in the medical record. There are detailed notations for recording eye movements. However, if you are new to ocular motility testing, you may want to start by simply recording if the gross ocular motility is normal or abnormal. If there is a new abnormality, notify your physician. As you become more familiar with eye movements, you will be able to identify if eye movements are in overaction or underaction, in what directions of gaze they occur, and be able to grade severity. Ocular motility should always be checked before the eyes are dilated. If there is ever a question, do not dilate the eyes and inform your physician. It takes a well-trained eye to pick up abnormal eye movements. Understanding strabismus and eye movement dysfunction and the basic testing used to detect them can take a good amount of practice and review.